Hello, everyone. Welcome to our live stream. My name is Maz Barami from Wolfram Research. Today, my guest is a very good friend of mine, Diego, who's going to talk about, how an infectious virus, especially, novel coronavirus, can spread over a big, geographical region such as the United States. If you have seen our previous recording, we started with, some live stream with Dr. Anton Antonov. Anton, he started with a simple model, compartmental model. Then he extended that. He started from a single site, basically, let's say an isolated population. Then he extended to a big, region, multi-site extension. And now, Diego, he's going to apply, that model for United States. Handing over to you, Diego.
Thank you so much, Matt. Hi, everybody. My first thing is a big thanks to my friend Anton for developing a series of packages that we're going to be using extensively today. They're very well built and provides a very robust framework in which we can use to analyze regional or any spatial condition to see how the epidemiological models behave. I would also like to mention that if you reach out to the community.wolfram.com, you will see a lot of great work being done in different models, either at the genes level and the coding of the gene of the virus, to many models in different countries. A lot of great work is being done. So please check out community.wolfram.com. Our model today will be based on the models that Anton worked on, and we will build on a notebook that's already published that explains where we got the data from. I made the data readily available for everybody. If you go to this Google Drive, this notebook will be published on the community. So there you will have it to go through all the links and get all the information and download it as necessary. So the first thing is we're going to touch the highlights on the spatial model, how it was built. My first thing is thanks to, you build on the shoulder of the great work of other people. There's a document that I used as base to make our model here, which is the modeling of spatial spread of infectious diseases. You can reference to that document that it's on Science Direct. There's a model that has been built around this paper that it's also readily available, and we use this as a base to build our model, which is basically creating first a population data level. This one has a representation of Europe. We'll use the United States. Then we'll have a mobility data network on top of it, in which we will focus exclusively on air travel. We left the commuting network aside to make the model simpler. And then the epidemic model will be based on Anton's packages. So what we did first is build this network of airport hubs, because our mobility data is based on airport transfers, people flying from one place to another. So you will see, for example, that you have different regions and different airports that we're interested in. And to start building the layer, what we did is we assigned a population to each one of these cells. How do we figure out what population to assign to each Voronoi cell or site? We take full advantage of great work being done by Columbia University. They did have a grid of, they basically divided the world in a grid of, you can make it as detailed or as granular or as wide as possible. And each latitude and longitude, they assign a certain number of people. So basically we downloaded the data from their site. And just to show you how this works, this is the whole data from the world. It's taken at a 30-minute angles. So each point represents that you see visibly is the population on that pixel. This is a zoom on the United States per se, where the population lies. So you see that in the west of the country, it's less populated. And then basically what we did is on the mesh or the Voronoi cell that will represent the population that is served by the Atlanta airport. We have several of the these latitude and longitude dots that have a population assigned, and we added all of those populations up to that Voronoi cell to set up how many people live on that. It's serviced by that node. One of the interesting things that we want to do is actually see how the population is distributed in the United States. So you have regions that are not that many population, and regions that are more populated, which we expect. But even though we see it this way, if we do the analysis of how many people are per cell, you see that there are a lot of, it's this power law that happens over and over and over again, power law distribution, right? There is a lot of cells that have smaller degree of population, and there's some very few cells that have a lot of people within that cell. So it makes more sense to analyze this information on a log basis. That it gives it a little bit more of a log normal distribution. So if we take that into consideration, this is a side note, you will see that more clearly that, you got the West Coast, the East Coast, and there are certain areas or geographies of the country that have a lower population. It's easier to see. So this explains that we have assigned a certain number of people to each one of these sites. And each one of these sites, we will be using to use the equations that Anton developed later. Okay, so this deals with population. Our next step is to look at the mobility layer. In the case of the United States, we made a simplification. We're not gonna be dealing with road or rail traffic between nodes. We're gonna just focus on air travel, okay? And one of the reasons we use the United States is that hats off for the US government as a policy of state. This country has a very open data policy. There's a lot of data that's published and it's readily available to the citizen to use. So for those citizens data science out there, this is a great place to be able to use the information that is available and analyze it.
Diego, one of our users, the question is about that segmentation. This segmentation, given the information about, airports and, population distribution, this segmentation can be done on the top of any country, right?
If the data is available, yes. So when we started on doing this analysis, Matt, is we wanted to do this worldwide. If you want to look at the airport and airport traffic between locations, what you'll see is that you have to pay for the information. For other countries, if you have to go to IATA and get that data and pay for it. For the United States, and we'll see here, is that the Bureau of Transportation Statistics publishes all the data. You can go to the website, it will be available there, and you'll see that there's information of airlines, airports, and air traffic. So you got the tables that you can actually download the data from, which is where I got the data from, right? And once you download this as a CSV or as an Excel, then you can actually take that data and build your information. This data is not readily available in other places. Well, at least I didn't check much except for the global and IATA. I don't know about other countries, but I know that in the United States it's easy to find. So I hope that responds the question.
I have a comment related to this.
Yes.
So we are concentrating here on air traffic because it's, first of all, US is huge, right?
Yes.
But in other countries, it might be much more, might be feasible to look at transportation by rail, by roads, and to evaluate migration of people in that way. Of course, we can do this for US, but also, I mean, the density of the population of US compared to the area, I mean, it's very different scenario than, say, some of more densely populated areas, so in some places in Europe, for example.
That's a very good point, Anton, and thank you for bringing that up. If you look at the papers published out there in highly dense locations like Europe, the United States, we have huge distances, and you may have the same situation in Russia and other locations. In the locations that are highly concentrated, that are high density, the commuting network, which we did not apply in this model, takes a big importance. It could be an order of magnitude higher from a transmission of disease perspective. So thank you for bringing that up. So one of the things that I wanted to show is that in the model, and it's very well, it's described on the document that we refer to, that it's published on the community. For metro areas, you may have many airports. Here you see, for example, the area of Los Angeles metro. So what we did is we took all the airports within a ratio of 150 kilometers and used one, in this case, the one with highest traffic for domestic, which is Los Angeles Airport, to consolidate and aggregate all the traffic from the other airports like John Wayne, Long Beach, whatever. Same, I mean, all the different locations within metro areas. This is my hometown, Atlanta, so you got all the different airports. So the main one is Hartsfield-Jackson, ATL. And Newark, one of the biggest hubs for the United States, located here. It's taking all the traffic and information from the different airports that serve that specific area, and we consider all those airports as one in our model. Okay. So given that we have that network, basically this is an overlay of the graph that Anton has discussed in detail in his last a couple of days ago, on how an epidemiological model can be placed on top of a graph, and how each one of these Voronoi cells or sites will constitute and have its own sets of equations. As another side note, which I find always very interesting, this is another package that Anton developed, and it's readily available for the whole community. It's open source. You can see the amount of annual traffic between different airports around the world. This is on a table view for the top airports, top 20 airports. But we can also do a Pareto analysis, which is very interesting. And you can see how 20% of all the airports represent 80% of all the traffic in the United States, which brings other considerations. If you want to take this model and explore it further, is that you can simplify your model by removing many of the sites if you wish to. It's another demonstration of how the power laws can be found in nature and in human activity. One more module from Anton is the heat map plot. It has much more functionality available that you can use. But this represents and shows you very graphically which airports concentrate most of the traffic around the United States. So this is the base of which we use to develop the model. The next step is, okay, it's applying that epidemiological model to what we have seen so far. So the first thing we're going to discuss is there are many models available for epidemiological, and everybody's invited to go and see in the Wikipedia what's available out there. We're focusing ourselves on the SEIR model. This is susceptible, exposed or latent, infected, and recovered. Okay. So just so we're gonna use the packages that Anton created, and we can see the different stocks of populations that we're gonna be looking at: total population, susceptible, exposed. The difference with the standard model is that we're gonna split it based on the disease that we are looking at today. Is that you got a normally symptomatic, we can call them asymptomatic in our case, that people state that it's around 80%, and people that are really affected and they're severely symptomatic. You're gonna got a recovery population, and we're not gonna deal with a productivity at all. A little graph plot to show how the people move through the compartments. You go from susceptible, if you get sick, you go into the exposed. You got a latency period, an incubation period that it's discussed how long it takes, and then you can go to either be a normal, symptomatic, or asymptomatic, or severely symptomatic. And from there, you will take some time until you fully recover. And we'll see on the model that were developed is that you have different parameters for this model. Death of population, death of the different boxes that might be included. What population goes to be either severely symptomatic or normally symptomatic, and then the incubation periods. So this model runs on these rules. At this moment, what we did is we went and looked at a paper that was published out there. It's not peer reviewed yet. There's a lot of numbers, a lot of ranges for all these parameters. So we just took one set to do this demonstration. And in this case, the rate rules is that we used for the United States, for the total population, the normal death rate, right? There's some numbers going around that for the severely symptomatic, it would be around 3.5%. For the asymptomatic, we just guess estimated 1%. And then you have the contagion rates, which we assume the same for both populations. Recovery number of days of 83 days, which seem a lot, but that's what's on the paper, and 6.5 days from exposed to actually start seeing the symptoms. This is the proportion that goes into severely symptomatic, and we're not dealing with any cause whatsoever. This is a set of equations that Anton has covered before. So in our model, the Voronoi population that we saw before, we have 167 cells. These are independent. So basically what we will do is we will take the daily rate. So we have from the Bureau of Transportation, we know how many people travel by air from one route to another airport. So we'll use this matrix and determine a daily rate of flights. With the functionality that Anton built, we can extend that model for each one and every site. Just as an example, you have the different equations. It creates a lot of equations. It's a very good thing because you can actually reproduce, look at this. So this is just for the rate of increase of the normally symptomatic population, which is the asymptomatic. And this basically represents the people flying in and out through the network. You can run the model. It will use NDSolve for the period that we're gonna be using. And let's see how many solutions we get. Let me run this, which will take a couple of seconds to run. And we will obtain a model that we can explore. While this is running, we can do some visualizations.
Diego, you did not set up the initial conditions and the rates. Cell 45, you see?
Yes, you're right.
Yeah, so that needs to be.
So one of the things that you can see once you run it, you will see, and we did it, this model that Anton created allows you to see how the infected, severely symptomatic population, what is the fraction of the population of each node at each given time. Let me see if this works. Yes, that's it. So we got 1,002 equations on the model, you know, between the different, so you got one function that represents the total population, another one that represents a susceptible population, exposed, asymptomatic, severely symptomatic, and the recovered, right? This is a result of how the disease spreads around the countries. It takes advantages of the nodes or the main airports around the United States, and then it will ease off. So one of the things that we wanted to share is, okay, let's look at, if you look at the network, you'll see that some locations are further away from, less connected to the network, and therefore they receive the epidemic later. One of the latest ones that you're going to see is this one in Silver City. This is a city very close to the Mexico border. It's the least connected one. If you see the the data of the satellite that you can see from Geo-image, it's not much there. So that's why it's not that very connected. And what we can see is, if we look at the, if we explore the dynamics, this model assumes that the patient zero started in the Washington area in Seattle, and then the disease just traveled from there. We just did this as a simulation. It could have entered in many different airports. We just decided to do this as a simulation. So this is the profile at, around the Seattle Tacoma airport. You will see the different curves, the total population. This is the exposed, recovered, etc. Exposed is this one. This will be the normally symptomatic, the severely symptomatic, which is smaller because it's 20% of that. And then people start recovering. This has a long tail because we saw that in the parameters that we're using, it's 83 days. And these are the two things that are being used. But what's of interest, if we can, you can actually use Mathematica to add all the stocks together for all the country, okay? And this is the profile. So you see the profile for Seattle. You see the profile for Grant County. You see that the curve is delayed for probably around 90 days. And that's because it takes time for the disease to hop between airports based on incubation periods and the traffic around. And then the curve in the middle is the aggregate function based on the parameters that we've been using in this model for the United States. So one of the questions, and Anton has been showing us a little bit on the prior conversation, is what about the implementation of quarantine policies? What can we do about it? We know that we don't have vaccines and we don't have any medical solution. There are no antivirals or things that you can take to reduce the impact of the disease. So the only available tools available are the two and tried quarantines. So one of the great things about Mathematica is that we can add anything on our set of rules. So in this case, what we did is we created with what's called preventive measures, given at a given time and a given fraction, which this means is that we say, okay, we're going to implement a quarantine at time t-stop, and you have a degree of effectiveness or the factor that you can actually reduce the contagion rates. So if you're very good or very strong on your quarantine, the fraction, you can really lower that contagion rate. Okay, so
adding this new feature, so overall, how many differential equations, like, you're solving numerically?
It adds terms. It adds terms to the equations basically, but the number of equations remain the same.
The same. So Anton or Diego, do you have any estimate, like, how many equations we have overall? Is it
this one is 1,002 final equations.
Yeah, this is with the adopted current model, right? But if you increase it, say, if you have a model which has 2 or 3 more equations, I mean, you have, like, say, I don't know, 1,200. We have done some more complicated, more refined models with a larger number of equations. Yes, that's important. But ND solve, yes, it's very serviceable and it can handle such.
We usually, like, internally at Wolfram Research, you would say that, ND solve is a beast. It's like the king of the beast among, building functions of Wolfram language.
Yeah, I don't know who programmed that, but
let me mention that, like, Dr. Anton of, Anton here, he has, like, some very important, contributions to that.
Yes. So
mine was in integrate, but ND solve was by Mark Zofronio and Rob Knapp. Primarily now other people have been contributing, like Oliver Koningberg and some others. But yes, I mean, in this office, a great function.
They're great people working at Wolfram, really smart. So I'm going to have to go fast. I've got 4 minutes left, unless we can extend a little bit. So what we did is look at, okay, this wave of infections for the United States. This is the spot at time 92 days in which you get the full brunt of full speed of infection. This is the wave front. This is the maximum, which happens at day 116. So what they decided to do is, okay, let's see if what times we're going to actually use for taking snapshots on when to start the quarantine and see how that affects the whole shebang. So basically what we did is, okay, let's see what happens if we do the quarantine at time 65, 75, 85. The maximum is at 92, 95 at 100. And here you have the curves and the results of how many people get infected. This is a model, it's qualitative for an explanation. So we see that here people start getting sick. The no quarantine scenario is this one over here. If you start looking or working backwards, if you do it too late, the effect will do is like 70% or 68% of the population gets sick at the maximum. Here it will go to 62. Here it will go to 59. But if you go and do this earlier, which has an economic effect for the country, what you see is you're gonna starting to see the impact on the flattening the curve and delaying the onset. The delay gives you more time to get the resources ready. This is taking consideration that you are 20% effective on getting the people to obey the quarantine. We're gonna see the effect and later of actually enforcing it stronger, which is much more important too. So first thing, start early. Second, it will be, and we'll see it, do it effectively.
Diego, we have about 10 minutes. So our broadcasting team, they were kind enough helping with 10 more minutes.
Okay, so then we can take a little bit more time. So what we did here is, okay, let's prepare an infographic for this thing. So we took snapshots. I kept rasters and things like that to allow to take snapshots of what would happen on each cell and be able to represent it in one single thing, which would be something like this, right? So you can see the hotspot started here. That's where we seeded the patient 0, actually patient 0 and 1 in Seattle area. And then based on the communication routes, the disease starts spreading, okay? So here we're looking at moment 96. The other thing that you're gonna see here is that, okay, here we have a scenario that we implement no quarantine. This is all looking at effectiveness of 20%. So, sorry, an effectiveness of 80%, that's a factor of 0.2. So this is, if I make the effect, I decide to, we haven't here started with the quarantine because it's at moment 96. This one we had just already started. This was started like 10 days, 11 days before. They started 21 days before, and they started even earlier. So you can see that you have a big effect, even with a 80% efficiency on start slowing the disease, which is what you see here. And we can run this and see how this spreads along. And today, if you check Twitter or if you look at academia.com, Nassim Taleb, Yanir Bar-Yam, and Chen Shen published a paper about the impact of non-pharmaceutical, or the actions that we're taking, which is basically lockdowns or quarantine, things that have been proven or tried before and for many years since the medieval times, something that it's lindy, and how the more effective it is, you can actually, if you can get, and we haven't discussed this today, which is the reproductive rate, which is derived from the beta we saw before and the gammas and other things that you can go on Wikipedia and read about it. Well, they published this paper stating that it's important to get this done earlier and do this effectively. So one of the things that we did is, okay, Let's run this model one more time. Let's assume that we're gonna start 75 days, but let's see what happens if you do like, you're not that effective. So let's say that you can only secure like 80% of the people to stay at home, but you still have 20% that still go to bars and restaurants and whatnot, right? If you go to, and that's be able to do this at 5% and 2%, right? Remember, this is qualitative, right? We do not have the parameters yet of this disease, but this gives you the direction, and it tells you if the policies that you want to implement are sound or not, okay? So just to show, so this is without the quarantine, right? This curve is okay, I'm gonna implement the quality at T75, but people go out to bars and mingle and go to discos or whatever. The next one is, okay, I'm more effective. Let's say we get to 95. Look at the curve. The thing is that you still have like 15% or 18% that will get affected. And we haven't put here a stop on the quarantine, okay? Which is another thing that we could have added in the equations. But the most important one is like if you make it really effective and enforce it, you basically nip this on the bud, right? And the reason why this takes too long is, the parameter that we've been using from infected to recover, which is very long, 83 days. We do not really know what those number of days are. Everybody's welcome to then download this document or build something like this and see how what are the effects if different values are applied. And just for some references, you will find in the document the papers that were used and other references that you might find interesting for you to try to use the Wolfram language and try this at home or at work or whatever you want to use it. Any questions, Matt?
I guess, right now there is no question. Very interesting model. One more time, I would like to re-emphasize that, both, Anton and Diego, they have provided a workflow. Like, basically you can easily modify or you can easily change, the dynamical equation. If you think like, you may have, a better model that resemble, the reality much better, and you can see the results. So as, Diego mentioned, you can play with these models, they are on the Wolfram community. And if you have any question, you can interact with Anton and Diego directly on the Wolfram community. Let me check one more time. Let's see if there's any question. Let me check, our Twitch channel. Okay, so thank you everyone, for your positive feedbacks. Thanks Diego and Anton for the great, computational exploration. Again, as a member of, Wolfram Research family, we wish all of you a very good and healthy days. Thank you.
Thank you. Thank you.